The FDA announced a plan to ban menthol cigarettes and flavored cigars here in the U.S. As Omar Villafranca reports, health experts say this could potentially help save the lives of hundreds of thousands of Americans over the next few decades.
The Food and Drug Administration says the proposed menthol ban could prevent more people from getting addicted and could save as many as 654,000 lives over the next 40 years.
There's data that has shown that smoking cessation leads to improved survival from lung cancer.
Dr. Raja Flores with Mount Sinai School of Medicine says he supports the ban because many of the patients, particularly people of color, are addicted to these cigarettes.
It's a big source of profit. It's the same population that does worse with lung cancer, that gets less access to treatment, and their survival is much worse. So to me, it's a no-brainer.
The FDA says menthol's cooling effect make it easier to start smoking and harder to quit. Menthols make up 37% of the cigarette market. They are the choice of 85% of black smokers compared to just 24.6% of whites. And more than half of young smokers choose menthol. Menthol cigarette sales made more than $30 billion.
When I actually want to go and I'm in a craving to find those cigarettes and I can't find them, I think that it'll give me a little bit of an extra push to not smoke anymore.
A spokesman for the maker of Newport cigarettes told CBS News, quote, "We do not believe the published science supports regulating menthol cigarettes differently from non-menthol cigarettes. Experts say it may be a year or two before this ban goes into effect." Errol?
Omar Villafranca, thank you. For more on this, I want to bring in Matthew Myers. He's the president of the Campaign for Tobacco-Free Kids. Matthew, thank you for joining us today. Why has it taken the FDA so long to do this?
It's politics, not science. Over 11 years ago, FDA's own Science Advisory Committee found that the science was overwhelming, that menthol cigarettes increase youth tobacco use, make it harder to quit, and removing them would promote the public health. FDA's own independent investigation just 2 years ago confirmed that, and study after study has found it. The Biden administration deserves credit. It's the first administration that is willing to take on the tobacco industry in a fight that will have a bigger effect on health disparities than any other action you could imagine.
That's pretty incredible. As we heard in Omar's report, Black Americans are more likely to smoke menthols as well as young smokers as well. Why do you think there is that type of link? There are reports that women and LGBTQ folks also more likely to smoke menthols. What's the association and the connections there?
Well, there's nothing inevitable about it. 50 years ago, fewer than 10% of African Americans who smoked menthol. What happened was the tobacco industry, as their own internal documents show, decided that this was a target market. And they targeted the African-American community first in the inner city, and then in other poor areas, and then in the rural areas. And gradually their marketing succeeded, increasing smoking of menthol cigarettes among African-Americans. The consequences are really tragic because not only does it lead more people to start, but menthol makes it harder to quit. African Americans try to quit at the same rates as others, but they fail, not because there's something different, but because menthol makes it harder to quit. The direct result is increased disparity in lung cancer rates and heart disease rates. Wow. That's why this issue is a social justice issue as well as a public health issue.
It is so incredible as you highlight those details and draw those connections. Let's speak about getting over something like this, recovering from it. I know Canada was one of the first countries to ban menthol cigarettes back in 2017, but researchers at the University of Toronto have since found that 24% of daily menthol smokers do in fact quit in 1 year. So the end is a possibility. Tell me about that.
Well, the Canadian experience, if you project it out to the United States, demonstrates that this proposed ban will result in over 1.3 million fewer smokers, almost 400,000 fewer African-American smokers. When you realize that 45,000 African-Americans die from tobacco use every year, what we're talking about is one of the greatest boosts in African-American health of anything that we could imagine. Many of these problems are really hard to do, But we know that we can reduce lung cancer rates and heart disease rates in the African American community if we ban menthol cigarettes and provide cessation assistance to that community, as the Biden administration has proposed.
Really insightful and eye-opening stuff. Matthew Myers there, thank you for your time and saying it all. The banning of menthol cigarettes, really a social justice issue. Appreciate your time today.
Thanks for having me on.